Good morning, everyone.
Right? I was trying to book it along with.
Okay. Good morning, everyone, and welcome to the second day of our conference on climate change, challenges for health, equity, and law. I'm Professor Jonathan Kahn, Professor of Law and Biology here at Northeastern and co-director of the Center for Health Policy and Law. I'm really pleased to have you all here today, both in person and virtually. Before we get started, I just wanted to mention a couple of logistical things, particularly for the people who are here in person. Bathrooms are just outside the door and straight ahead. Okay, we've got some food back at the rear wall there. After the keynote and the plenary, which are in this room, there will be a series of concurrent sessions, some of which will be in this room, which is called Raytheon, and some of which will be in Egan 440, which is on the 4th floor of this building. You can get there either by stairs or elevator, and we'll have some students out there to help direct you if you're having trouble finding anything. That actually brings me to just a few quick and heartfelt thanks I would like to mention before we get started. First, to the students who are helping us out today, the law students who generously volunteered their time and knowledge. Also to Siobhan Fanning and Deborah Feldman, who have tirelessly helped to promote and coordinate aspects of the conference. And certainly for Jennifer Hewer, the managing director of the center, who has been responsible for organizing and keeping everything running smoothly, and who's done a fantastic job in pulling together all the logistics and helping in so many ways with this conference. And then finally to our dean, James Hackney, the Dean of the Law School, for his great support and ongoing interest in the center and its work. And it's to him I would like to now turn things over to introduce our keynote speaker. Oh, excuse me, welcome you all, and then I will come back and introduce the keynote speaker. Sorry, Jay, right, a little terror there for a second, to welcome you all.
I was a bit nervous. I thought you flipped the script on me a bit, and I would have had to do a quick Google search to figure out anything. Anyway, welcome everyone. It's great to have folks in the room, live and in person. I love the energy of us getting together, but also as well, folks who are joining us virtually as we navigate this, I guess we can refer to it as in-between space with regard to the pandemic. So again, welcome everyone, and thank you for coming to Northeastern University School of Law's annual Health Law Conference. Climate Change, the Challenge for Health, Equity, and the Law, hosted by our Center for Health Policy and Law. The Center for Health Policy and Law is one of our 4 centers of excellence situated within the School of Law, created as part of the university's Northeastern 2025 goals. The center is also charged with the mission of creating and strengthening interdisciplinary collaborations across the entire university. Faculty associated with the center represent a vast field of study, including law, health sciences, business, political science, and biology. In addition to the wonderful conference, the center oversees a robust portfolio of events: the annual Health Law Lecture in the fall, monthly roundtables on a diverse array of health-related topics, and community forums designed to address and discuss timely state and national health law policy issues. The center also actively engages with our students by supporting our Health Law Scholars Program, liaising with the Health Law Society, mentoring law and health sciences students, and organizing student-focused events and initiatives, such as a yearly health law networking reception, film screenings, and discussion and advising groups. The Center for Health Policy and Law has experienced tremendous growth over the past couple of years, and we're all excited to see Northeastern's reputation for excellence in health law continue to flourish. U.S. News and World Report recently ranked Northeastern Law number 7 for healthcare law among U.S. law schools. I will now hand things back over to Professor Jonathan Kahn, who will introduce this morning's keynote speaker. Jonathan. Thank you.
Okay, I'm back. Here we go. I am really delighted to be able to introduce our keynote speaker today, Dr. Cheryl Holder, who is joining us virtually, and so particularly those of you on Zoom will be able to follow along with her slides, which will be screen shared with you all. Dr. Holder advocates for comprehensive medical prevention and care strategies for poor communities impacted by climate change. She has dedicated her career to caring for underserved populations and promoting diversity in health professions through pipeline programs. She is a founding faculty member of the Herbert Wertheim College of Medicine at Florida International University. As the Associate Dean for Diversity, Equity, Inclusivity, and Community Initiatives, Dr. Holder integrates diversity, inclusivity, and social justice in all of the College of Medicine programs and operations. She also teaches medical, nursing, social work, and physician assistant students about working in underserved communities through the Green Family Foundation Neighborhood Health Program. Dr. Holder is president of the Florida State Medical Association and serves as co-chair of the Florida Clinicians for Climate Action, where she works to increase climate literacy and enhance awareness of the impact of climate change on vulnerable populations. She's the recipient of the 2016 FIU Medallion Cal Covens Distinguished Community Service Award, the 2017 Faculty Convocation Award in Service, and the 2019 Co-Humanism in Medicine Award. Holder began her career in 1987 as a National Health Service Corps scholar working with medically underserved communities in South Florida. From 1990 to 2009, she served as medical director for Jackson Health System's North Dade Health Center, where she developed an HIV care and treatment program and directed the first school-based medical center in Miami-Dade County. Without further ado, I would like to turn it over to Dr. Holder. Thank you so much for joining us.
Good morning, everyone. Thank you very much for the great introduction and for inviting me to speak at Northeastern. I am linked to Northeastern in that my son went there, graduated in 2013, and had an incredible experience. And so it's good to see and meet the faculty and hope students at some point in my journey in climate. I'm going to start sharing my screen and talk a little bit. It's always to get it in. Okay. Let's go back. Thank you very much. And you know, we've come off a pretty difficult 2 years, and I've been practicing medicine for 37 years, as 37 for a long time. I left medical school in 1984. So you can understand these last 2 years being difficult, but these years have shown us so much on what you in the legal profession have seen the importance of the role of how we all work together in improving our society. And we saw who is affected most, how the pandemic exacerbated so much of the ills that we've been experiencing in our society, and what we can do about it. I always start all my presentations with anime. This is not her. but she looks so much like so many of the women that I've cared for over my last 30 years, because I've worked again mainly in Black and brown poor communities. And she came to me with her usual health problems in an old house, asthma, COPD, diabetes, overweight, lots of medication, lived on a little fixed income, doing the best she can, but she needed refills. And as she was about to leave, and I was rushing her through, I said, I don't know what's going on. How come you're out of medicines all of a sudden? You never run out of medicines. And then she's like, oh, I've been short of breath, breathing, but doc, can you help me with this bill? And it was her Florida Power and Light bill. And she wanted to see if there's any program we had, anything we could do. And she gave me a form to say, if I signed off on this saying she had health problems that needed a machine, she would then be able to get her bills waived. So that started my investigation in why would Miss Anna Mae not be able to pay her light bill? As simple as it seems, not paying the light bill, what does that have to do with her health? And that made me realize that summer of 2016 was one of the hottest on records. And I started seeing more that not only were the days hotter, but the nights were hotter. And so Miss Anna Mae never got any break. So her COPD worsened, and any AC she ran seeped through her cracks, seeped through the poor insulation, seeped through her poor housing, and sent up her bills. And I started learning more about what is happening to our climate, because you can't forget 2016 when we started hearing more and more about this climate. And where did all this greenhouse gases, where did it all come from? In my medical community, we're responsible for about 8.5% of the greenhouse gases in this country. If we were the world, the health sector would be at least almost 4% of the world. We're number 5, just the health sector alone. The US gas emissions, transportation, electricity, the industry, agriculture, we lead in polluting our environment. And if you get a little, this is my quick Climate Change 101. I'm sure you've had some over the last few days, knowing that we have like a fleece blanket surrounding us because all those particles that are suspended in our atmosphere is causing the reflection of the heat not to go back out, but to stay and warm us. And as it warms and the increase in the pollution, we just get too much heat. And that thin line is what is the barrier. That's what keeps us alive. How much? Not too hot, not too cold. And it's what we have done to that little thin line that has caused people like my Miss Anna Mae and many of my patients to suffer now from the impact of climate change. And I told about the health sector, how much we impact, and our role in understanding that intersection of climate and health. And we learn more about our environmental factors and the impact, and just the heat alone. As we've risen the temperature in our world, the poor people who live closest to the damage are seeing the effects. We now know that it's directly related to preterm labor. We can't prove it because our data isn't perfect, but we see our correlations clearly that people who live in hot areas, people who are exposed to more pollution, have preterm labors, have worse outcomes of pregnancy. And we know this with asthma. And it's no surprise when you see who we've seen with asthma over the last 50 years. You've heard the data. Black and brown people, the rates are tremendously high, and Black women are dying at highest rates from asthma because, again, what we've done with our greenhouse gases. And when you look, anyone, I tell you, our pollen season, and every year, I was just in the New York Times about the ravages of pollen and how it's starting so much earlier. And whether you have poverty or not, you can't escape what was happening now with our pollen season starting weeks and weeks earlier, because with the high CO2, the trees are growing faster, the flowering is more intense, and we're seeing the change in what plants end up in our environment because there's so much movement because of the heat. And what does that mean for us? And just coronavirus. We know that some of the deaths were disproportionate in Black communities and poor communities, but we have to say in polluted communities, because that virus also hooked onto the pollution and had a larger amount of load that infected the person and had a rising level of death. And then there's so many ills when you think of what's happening across the insect world. The insect world is also being impacted. And something as that the mosquito that is such a pest for us. But when you think of what the mosquito can bring, and as it moves in this region, and you can see that the range is moving further and further north, moving from the tropics all the way into the Northeast. And as it moves up, the different vectors, like the mosquitoes, like the ticks, you're going to see more and more diseases in places we haven't seen before. You're in the Northeast, you're going to see more West Nile, you're going to see much more, it's endless, the numbers that we anticipate. And I'll try not to get too much into the medical side because these diseases may change, but the important part is knowing that with the heat and the change, it's going to, where it lives are moving. And with that, we'll see more disease. And I think again of this problem that we see, that we hear about the infections, but what is the health and the mental health of somebody who's enduring, going through these diseases? And my patient Maria, when she came to me, she was a young woman, had her baby. She moved in from Central America, and she had been undocumented and was working during one of our times where that mosquito had brought Zika into Miami. And in doing that, she got infected, and she was so worried that her baby would end up with microcephaly. And so even after being told everything seemed fine, 2 years later, she was still suffering from postpartum depression. And that is what I had to work with her through. But the effects didn't just start when she got her infection, but it persisted and continued many, many years later. And we see the same thing when we look at what happened in Puerto Rico when Maria hit back in 2018 and the impact. We saw a rise in suicides, and we see that across the board in most areas as we see the change. Within heat, we see a lot of anger, we see a lot of violence. And this picture comes out of Louisiana. And last year, Louisiana went through 5 extreme weather events. And of course, and I bring this with this little girl in pink, because that's often what you see, where the younger people, the children are impacted. And again, poor people, which in our country is often people of color. And we know that our climate has changed. There's no more denying it. But what is the impact? The migration we've seen has worked worldwide. But in the US, think of those wildfires in California. Where did all those millions of people move? Or that tornado that ripped through the Midwest and took out about 1,000 homes. And where I live in South Florida, we're dealing with what we call climate gentrification, where the people in the higher ground, because of poverty, because those are where the railroad tracks were often placed to live in those areas. But now the developers want those areas because there's less flooding. The migration is on. We've seen many of my patients from Central America came into South Florida because their crops died, because the droughts and the heat, and they can no longer survive in Central America. So the movement is on worldwide, between Europe and the Africans moving through to Italy, the Syrian conflict, which goes even closer to the migration of their farmers because of drought, which then destabilized their cities and destabilized the government. So the migration is impacting us now. And with our response, what will we do? Even looking at the Ukraine crisis, there's a water issue and there's an access issue, which then pushes the powers to make changes. And so if you just look at all the diseases, and that was just a little bit of the things that I talked about, and I use this mnemonic heat wave to help to sort of remember and help you go through all the major ways that it happens. And even if you are totally impacted now. There are many members of your family, of your community that are right now experiencing something related to heat. But what I really want you to pay attention to, I use this iceberg because we are at the tip of the iceberg in understanding the impact that climate change will have. And the biggest changes are already on now, but think about it as we warm even more and we hit the middle of the 2030s, 2040s, which is probably the prime time of your careers. What will we see? What will you endure? And we know this is going to happen. But none of this happens because by chance. As you understand, everyone's health, everyone's life is impacted by where you live, where you work. We call it the social determinants. The socioeconomic factors drive this. And that's why as legal professions, you have to have a full understanding of what makes you sick and what we have to do as a society. Because these conditions that we live under, especially our access to money and power, is what is going to drive us in who decides who lives and who dies. And our fact is that our low-income communities, again, are exposed to these pollutants. They live in inadequate conditions. Again, think of my anime in her little house in this community called Opalaka, desperately trying to breathe, but so much stacked against her. And then having the increased cost of trying to pay for that light bill. And you think of our population that is highest growing in this country, the Latin population. Think of where they're living. Think of where they're employed. Agriculture, manufacturing, construction. Biggest exposure to heat and to the changes. And again, if you look at our distribution from the census, from the age, we're looking at a larger, older population. Older people have a lot less resilience to heat, to these changes, to these extreme weathers. And as our population ages, the biggest burden will be on us, and especially this new generation that's emerging into the 2030s, 2040s, in how they will respond. And I take this from my student who was in Alabama at the time when the tornado went. And he says, worst of all, it went through the poorest of community. Now, as legal professions, you know policy matters, and it's absolutely important because despite everything we do for our climate, it is policy that will drive the change. It has to be political will to make the biggest reductions in our pollution beyond what you can do as an individual, what I can do, what our little communities can do. We need major policy changes to be able to impact the reduction in greenhouse gases. And so policy matters. And policy matters when you go back again, rethink what we've gone through. And we've gone through George Floyd, and we've gone through a policies, the result of a policy that started in 1619, which chose a group of people to devalue and created a system and by devaluing a group of people, allowed that people to be treated less than, to have less access to resources, to live in more polluted communities, to actually place the pollutants in those areas and result in what we're seeing now, and resulting in a poverty where we see that the income of these populations that have been devalued based on policies still make much less on the dollar. So then how will they be able to respond to the ravages of our climate change? And again, policy and laws drives everything. So it's important that we understand that, because even the heat that I talk about, those pregnant women that I talk about, they didn't just choose to live in these communities. They were often based on policies that redlined areas, that created devalued and disinvestment and put more concrete and less trees. So that then created heat islands. And it's throughout this country and throughout the world that we have to look at how our policies impact our people and how we must then move towards making those policy changes. And I bring back to the census because we see even more as we talk about our location and where we're seeing the heat and where we're going to be impacted. Our population has shifted to the cities. We still have more rise in people of color, which tend to be poorer, but a slow decline in younger people. So when you see we're dealing with in the next 10, 20 years, when the largest rise in our temperature and the most changes we'll see will be with a United States that will be older, with less younger people, more poorer people, more people of color. And even so, considering that the people of color have been undercounted. So if we come into a system that has devalued and will not adjust to systems because where you allocate your resources and where your access to money and power lies within the dominant group, what will happen to our society? And I put in Florida that within the 2036, we're looking at 105 days where you're going to feel like it's above 100 degrees. And that's just Florida. Think of Arizona, think of some of the other states, think of the places in the world, Africa and other places that will have this tremendous impact. And the flood waters that will happen, we see where we're going to have the sewage backing up in our community, where we have septic tanks, the flooding in North Carolina. The report just came out that along the north, the communities of color in North Carolina, Georgia, in most of the floodplains are going to have tremendous amount of flooding. They push into migration. What will happen is people who we have a difficulty in incorporating in our society start moving. And this is just a picture of Florida, what will happen if nothing is done by 2050, where the end of our peninsula will be underwater. But of course, there are solutions. And again, the biggest solution has got to be stopping the fossil fuel use, moving towards zero fossil fuel, hopefully by 2040, 2050, but moving quickly. But I use this picture here, this graphic, and it comes out of viral pandemic. And it captures so much what we have to do in any pandemic, where it's a responsibility on both sides. How much we share, what are the roles we have to do, what is our government, what is our policy, what are we going to do in our society, how do we vote, what changes are we going to enact to make sure that as a community, we protect those, we move forward, we decrease our fossil fuels, we make the changes. Then individually, what do we do? How are we going to increase our education, understanding where our roles are, what we're doing within it, what changes we can do? There's some simple things I tell everybody: give up meat at least once a week. Something simple. Educate our girls, educate, support women farmers. These are some simple projects that could be done now that we know would decrease forestation, would increase use, proper use of allocation of our resources worldwide. Voting appropriately. No longer can we sit back and allow folks who deny or who continue to push for fossil fuels or autocrats to be able to take over the world. And looking for good messengers. Of course, health professionals are the top messengers, but lawyers are right in the middle in here. They're not the worst. Legal profession has a role. And when I look at the health sector, where we have 22 million workers, 3.8 million nurses, 1 million doctors, if each of us become totally motivated and understanding this and start to push the word, we will meet thousands and millions of people. The legal sector has 1.3 million lawyers, 330,000 plus paralegals alone in the US. If each of this profession decided to take on the role of understanding the importance of climate change, accepting that it's happening now, and knowing that our systems and our policies, which leads to devaluing folks, not putting the resources where it's necessary, and decreasing our use, is driving this, we can have an impact. Where I am, we've created a medical legal partnership with climate. And one of the first things we've done is look at the laws and see how can we help our patients who are living in conditions like Miss Anna Mae, or like our poor kids with asthma. If they're in an unsafe building that is hurting their health, how can we get them to get reasonable accommodation and use the disability law in Florida so that they can move and break their leases? So there are other solutions in bringing the medical legal together to look at how we can work together to address climate change immediately for our patients and also for the rest of our communities. We invite you to take action. You must get engaged. There's a book, Project Drawdown, that anyone, it's really easy reading to learn many more solutions. We have to educate and we have to advocate. I have the Florida Clinicians for Climate Action that was formed to push this message around clinicians, to mobilize those 22 million health sector workers, to mobilize them to impact the rest of our society. Again, same thing can be done with lawyers, mobilizing the lawyers to get out there and make that change. But you must start with continuing to educate yourself and getting engaged. We've got to act now. We've got to remodel our systems, incorporate much more economic and social justice. We've got to move way beyond just the economic factor, but understand how they all intersect. We need much more of this in your curriculum from the very beginning, especially for the young people, where you're looking at 2050 with 105 degrees, 105 days out of 365 being hot, pollen counts that's going to be unbearable, flooding, storms, intense weather. How are you going to do more research? How are we going to get the policies to guarantee that we get payment on this? And how are we going to prepare our communities and decarbonize our systems? We must decarbonize. I use this graphic here that we all come to the world with all different abilities, whether it's a wheelchair, Black, white, women, young, old. And what we do by saying we'll get equal access and equal doesn't work. We want to move towards the world where the barriers are down and each of us gets exactly what we need to be successful. I love the INC report, the IPC, the UN, the interprofessional panel on climate, where it says the efforts that improve livability while reducing greenhouse gases are more urgent. Absolutely. But we must prioritize equity and justice, gender and income inequalities. Again, none of this happened overnight. None of this happened by chance. People didn't just be in the position they are. These all were driven by the laws and the policies, and that's what we must do. I show you this picture. It is Christ descending into hell. It's done by a person who works with FIU, and it is Good Friday, and it is the Passover. And this picture depicts a time in Christianity that talks with God during the crucifixion. And the cross in Christianity often means God's love with justice. But when Christ descended into Hades, into hell, he went there and he crushed the evil, but he also gave tremendous forgiveness as he came back out and he rescued and triumphed of good over evil. So as we see this climate world during this Good Friday time, that is what we are counting on, is that we as a community will be able to make those difficult choices and develop that political will to absolutely go in and decrease our use, push our policies, push our government, and understand that the valuation that you place on people allows you then to oppress and abuse. And I bring you this. This is my patient, Jorge. That is him. And he is an outdoor worker. And he sold those fruits on the streets every day in Miami. And Jorge was undocumented, and older. So he had very little opportunity to do much more. And he lived in that building behind the house because that's all he could afford. And that is the only window that you see there. And he was hot and his kidneys were not doing well. And every time I talked to him, I said, we got to do what we can. And he agreed to do this picture and do a story about the heat and his impact and what climate has done for him because he was dying. But he says he wants to remind everyone that rain or snow, heat or cold, he has to work. And for most of our world, they have to work, they have to survive. But it depends on people like us and people in the legal profession, health profession to work together to understand that if we address the climate and help people immediately, like Jorge, like Miss Anime, like the folks who live by the railroad tracks and the people who live by the flood zones and the people who are suffering right now, we make an urgent change, because anything we do for the climate will improve their health. And if we target what we can for this population, we'll have an urgent reduction and we will meet our goals. I say join me and join any organization that is working towards this goal, because this is our biggest threat to this society, it's the biggest threat to the world, but it is an opportunity for us to implement everything that we believe in as lawyers, as doctors, as professionals, as humans, in how we're going to work together to better our societies and better our world, and understanding that the least among us will lead us. And in solving and working for the least among us, we benefit all of us. Thank you.
Thank you, Dr. Holder. That was really wonderful. And now we do have some time for some questions and further discussion. We've got both, if people who are joining us virtually want to type questions in the chat, Jennifer will moderate that and try to call out read out some of your questions. I'll communicate them, and if anybody here has, you can start with. Oh, please, yeah.
Sure. Thank you, Dr. Holder. That was fantastic. Can you hear me okay?
Yes, definitely.
I especially appreciate your message about the importance of building political will and doing that through encouraging everyday people, lawyers, doctors, others, to talk about the problem of climate change and to make finding solutions to the problem of climate change a collective endeavor. I'd love to hear more from you about what messages have resonated with the physician community best to encourage that kind of conversation, because in my own experience, it's been hard to get people to talk about this problem, knowing how political it is.
Yeah, thank you for your question. Doctors are tough, as you know, health professionals, because they tend to come from conservative. Just to be able to get through those many years of study means you have a group of folks who are very disciplined, don't take a lot of risk, and want tremendous amount of evidence before they move forward. But the impact of the health is so clear now, much more so than it's ever been. So it's a lot easier. So what we find is the health impact, every single specialty is feeling it. Whether you're an allergist, whether you're an internist, the surgeons, extreme weather events, which are happening at tremendous rates. When you think of the traumatic injuries that happen with the extreme weather events. So it's a lot easier now to see. And the cost, because every time these extreme weather comes in, you decrease patient visits, you see the cost of electricity, the cost of pollution, just the overall cost of doing business is impacting the medical profession. But the health impact is what is driving it. One thing we have with healthcare, you may hear all the negativity about doctors, but most doctors really do go into this to make an improvement in health for our patients and our communities. So that has been the biggest thing, is identifying which health impact for each specialty, like dry eyes, huge problem. The allergies for ear, nose, and throat. When I think of the link of the extreme weather with diabetics who need treatment for their retinopathy, or think about it, they get interrupted, or cancer chemotherapy gets interrupted with every time you go through the storms. You guys get nor'easters, you get flooding, you get everything. That interrupts a lot of care. And also the infrastructure in the health systems. So it's at this point, unfortunately, because it's so in your face, I'm having a lot easier time having folks recognize that they have to take action. Now is to understand that these individual efforts are important and it must start, because we have to all do our share, but we have to push for some bigger changes. And that's the part that we're going to need a little bit more work. But we're getting more individual efforts by physicians in the hospital systems.
So, Dr. Holder, I have a quick question. I loved, of course, as a law professor, your reference to the medical legal partnerships. I very much appreciated that. And I was thinking in some ways, sort of to maybe flesh that out a bit, and to also think about, as we are educators as well. I'd be curious to hear, first of all, I guess, your experience in medical education to begin with, where we have these concepts of cultural competence and the emerging move of people talking about the need for doctors to learn structural competence as opposed to just cultural competence. I'm wondering if you've observed in education, in medical education, or where you might see opportunities in a sense for developing, and you sort of alluded to this, the idea of climate competence, right, among practitioners, and where in that realm, in those issues, where you might see other opportunities, or sort of fleshing out the idea, the types of opportunities for partnership between lawyers and or legal education and medical education and or medical professionals.
Yeah, the health professional curriculum is tough to get changes in. And the urgency of the climate matter has forced us to reevaluate how we're going to use the system. So what we've been doing and what we're pushing in the industry, and maybe with the movement, is looking at existing courses, and luckily we have computers, see how we can start bringing in the topic in every single case study in different areas. You can do it in the law. When we talk about even tenant law, you could see, was the tenant impacted by climate? And just when I talk about mold, mildew, living conditions, how you can integrate it there. We know that we have to move it a lot faster, but to get it in immediately, we've had to find courses and find the professors and ask the professors to change a case. If you're going to do physiology on different systems, why not put that case in a hot climate? So that's how we've been trying to see how to get it into the curriculum immediately as we push for formal education and a formal course within the next 2 to 3 years. So it's a two-pronged approach where immediate entry at opportunities, and that can be done now in any profession, and then to get the long-term course. We're having less resistance because everybody's dealing with the impact of the climate, especially with the extreme weather events across the country. And of course, you have to prepare your patients, because how are they going to deal with having to pack up your things and take those children and move to a shelter and maybe never go back home? And then what does that do to your community? I mean, doctors are part of that community, lawyers are part of that community. So if they feel that any of these events are going to not impact them, it's really keeping your head in the sand. And that has helped us having less resistance from most of the people in power, most of the curriculum committees, in getting key cases in immediately and moving towards a formal course. The National Academy of Medicine is now working with the health system and will be putting out recommendations within the next 6 months of moving to decarbonizing the health sector. And one of the big pushes will be moving the education faster into preparing our health professionals that are coming out now, because you look at 2036, 2040, we need the folks to be very, very prepared to be able to tackle these problems. Now, the medical legal, climate is the opportunity for the world to come together. Just sort of like how coronavirus has done, where we've had cooperation within the science world in getting the research and moving it rapidly to the vaccine. And now looking at this whole supply chain issue that shows the world are so interconnected. Climate is going to push us to do that. So there's these legal partnerships are going to have to come together, because as you look at the liabilities involved, the preparation, right now we're going through a major insurance issue down here in South Florida, where and they haven't quite said it, but there are a lot of insurance companies that are leaving this market because they predict the amount of costs will happen if we go through 5 or 6 major storms and cause tremendous damage. So how are we going to deal with the insurance structure? The legal profession now has been trying to get the insurance companies to pay homeowners to repair these homes after the damage is in. So you see already just in insurance and the law and the health, because the homes have mold, they have mildew, how do you get the change? So we can't separate out the health impact. And I think if the lawyers work with us to see that what has happened with these climate changes on the health has impacted the living conditions. So when they take these things to court and they can give us the data and we can help support what happens when we have to get the laws changed or get the insurance companies to pay. So every facet of life, we have to start linking together, because the climate is not simply just affecting one group here. Once you hit something that affects your entire community, it means the law has to be involved.
Maybe he just wants to say it out loud.
Okay, Michael Sinha, can you ask your question? Do you want to try to ask your question online? I know verbally, and if not, we'll try to read it out. Oh. Or yeah, Jennifer, why don't you read it out?
Dr. Holder, can you hear me?
Yes, I hear you well.
So Michael Siddle, one of our affiliate faculty, says, I really appreciated the application of Dr. Ian McKay's now famous Swiss cheese model of pandemic defense to climate change. Since we're now seeing a shift from public health to personal responsibility in the context of COVID-19, do you think a similar shift of responsibility, for example, from the global community to the individual, is likely with respect to the health consequences of the climate crisis?
I don't see it, this society, and that's a cultural thing of the individual. That's a very a dominant culture approach to looking at problems. And we know that it's policy that drives things. It's your social determinants. It's how you live, work. So the individual does have some responsibility as I see it, but the responsibility comes much greater in the vote, in educating yourself, and pushing the politicians to do the right thing. So that's where I see individual responsibility. It's very difficult for the individual to take much control of their health. And then you can see it, and you saw the graph that the graphic which shows your personal behavior is only a small portion of what makes you well. Because I don't care how wonderful that mother was who took her prenatal vitamins and did everything. She lived in a heat island. And in the summer with her pregnancy with 100 degrees, no matter how hard she tried, her preterm labor happened. And so this is where we have to push back against folks who are pushing this individual control, because we know that the real issue, and to use the evidence and the facts. So it's not that we don't see that the individual can play a role. Again, like I said, we should all be going towards a plant-based diet because it helps the environment and it helps your health. So I push for a lot of individual responsibility because it's it improves the health outcomes. And so while we're pushing for the policy change to decrease fossil fuel use, shift to renewable energy, we also get the health benefits. So we can do both. But the individual is going to make that change to stop that rise over 1.5 degrees, it's not realistic. And so we want to keep the use of the evidence and understand that, yes, the individual have a role and there is individual responsibility, but the best impact and where we're going to make the change that benefits all individuals is the individual working together to move that political will. So yes, individual responsibility is key, but how do you use that individual responsibility is where I often see that we take the simplistic approach, thinking that the individual is going to triumph over good policy. The data is in, the evidence is there, and as professionals, we must push and stick to it and not get caught up in political or religious ideology if we're going to really improve our world.
One thing, if I may, Dr. Holder, to follow up on that idea of individual responsibility. I don't want to monopolize things here, but is this, I'm wondering if you have observed in this, particularly in this distinctively, US focus on individualism, in sort of characterizing the health impacts of climate change, whether you have observed a tendency among, particularly people in medical or scientific communities to try to locate that impact, not in the climate, but sort of like in the bodies of the affected individuals, especially when it's disparities, and to say, oh, it's a problem of sort of racializing the genetics of it and saying, oh, well, it's having a disproportionate impact on communities of color because of these genes, kind of thing. And whether or not you have been observing that and what that has been like.
Yeah, that's always a fall position. And I think when I see it, it's especially as they push with personalized medicine, it always makes nicer way of making more money by bringing it to that individual and the genetic basis. But the clear evidence that genes are about 10%, because I always bring folks up with Chernobyl, especially with this Ukraine incident. After Chernobyl, those same genetics that did not have cancers, there's an increased rates of cancer because they were exposed to radiation. That's where you live, where you work, where you play. Chernobyl is no different from any other group of people. And we know there is no race. So what you see is just a social construct of the poverty, and the only thing that race has done is identify a group of folks that will be devalued. So when they were putting all these polluting industries, they often put them in poor communities of places where they felt it didn't matter and they had no power to fight back. So then you saw the vestiges of all that pollution. You saw what happens with poverty. You see what happens with the systems that work against people. Our genetic variation, we all know this, but it does make a nice way of distributing resources to an area which then tries to improve the genetics, which is a huge multi-million-dollar industry that then benefits a certain group of people. So it's always a nice fallback to think that because I produce more melanin, somehow I'm very different than somebody who produces less. And we know there is no race. So it's economics is political. It's also the biases that people bring to human relationships. I'm learning to speak. You'll hear me. I don't use race in these terms. Our governor just signed a law yesterday. Like we call it the anti-woke bill. That's what he calls it. I don't even use woke as a terminology, so not my generation, but he calls it that. And he has now outlawed the use of anything that would point out any differences that a group that we have called white has done for whatever reasons. So it's made it much more aware. And I think it's pushing, hopefully it'll push us to realize that we are one race. I mean, we have to look at every negative experience and see what we can get out of it. So just like climate change, I think has brought us opportunity to push for education of girls and women, increase in small farmers, increasing our ability to work together across the socioeconomic groups, because we have to bring our planet and to think of more than just humans on this planet, to think of the other animals, think of the plants, think of the insects, think of everything that is going to have to survive in this world. So I look at the opportunities that it brings. And similar to this new anti-woke bill that he just passed, that it may push us to understand and move towards race in terms of DNA and all those factors, but to understand that there is a group of people that are devalued. And when you devalue people, you tend to oppress and you tend to create decisions that do not benefit them. But in the end, it all hurts all, just like pollution, because if we stopped all that pollution, hundreds of years ago, as we industrialized, not in my backyard, and had done that, we would have moved to renewable energies years ago because we already knew the health impacts, the cancers, the asthma. We saw it, we knew it. Yet we didn't, because it often impacted disproportionately a group of people that were chosen as the less than. So we paid a price for policies that do that. And I think this gives an opportunity worldwide to say, how are we going to look at the world? How are we going to look at our insects and our plants and everything else that we do? So we move away from the less than and move away to a system that benefits all of us.
Well, I certainly appreciate your and applaud your attempt to make lemonade out of the lemons of that bill. So I'm just going to ask do one more sweep to see if there are any further questions or comments. Okay, well, again, thank you, Dr. Holder. This was really wonderful. I'm so glad you were able to join us and give us this wonderful overview of these issues. It just sort of frames things for the rest of the conference today wonderfully well. It gives us a lot to think about.
Thank you. And please do one thing. I pledge everyone. I have a TED Talk that goes through the issues again on TED.com. But I encourage you to do one thing that benefits your health and benefits your climate. Plant-based, you don't have to go all the veg, but please look at the plants, stop the single-use plastics, and start educating and voting appropriately. And don't let anyone get off with the ideology and moving towards a way that keeps their head in the sand. Thank you.
Thank you very much.
Okay. Bye-bye.
Okay, so we have now about a 15-minute break before our plenary panel begins. So you can get